In 2023, more babies were born to women over 40 than to teenagers. It is the first time that that has happened in this country. And we want to bring in Dr. Matthew Knight. He's the president of Knight Dermatology Institute. And he's a good friend to Good Day Orlando. Great to see you, friend. How are you?
Great.
Great
Thanks
to
for
have
having
you.
me.
So this is fascinating, right? And we're sort of seeing the tide turning. In a way, it's one of those things that over 40 is really not the best time to have babies because we're sort of past that age where it is technically safe, right?
Isn't it crazy? I mean, it was only when we were in high school that they were talking about teen pregnancies and what a big deal that was. And there was all this PR campaigns. Like, do you remember those MTV shows like 16 and Pregnant or Babies Having Babies? It had a tremendous effect on teen pregnancies. After those shows aired, teen pregnancies went down by like 10 or 15%, almost solely due to that. And of course, there's access to contraceptives and things that have played into that. But if there was a 200% increase in women over 40 having babies over the same time span, which is just wild. And it's because of social pressures and economic pressures. And there's a lot more technologies too out there, like IVF and egg freezings and things that make that possible. And of course, there's a lot of celebrities that are having babies in their 40s and 50s, like Salma Hayek and Nicole Kidman, that is normalizing this kind of stuff. And there's a lot of social cues where people are absolutely waiting longer to have babies.
Wow. Well, let's talk about some of the difficulties that go into it. And you brought up some of them, right? Is that having a baby over 40 oftentimes means that you have to get some type of fertility treatment, right? Which can be very expensive.
For sure. And that's part of the celebrity thing, is that celebrities have unlimited resources and have access to things that most of us will never have access to. But, you know, if you're over the age of 35, the American College of Obstetrics and Gynecology considers you advanced maternal age. Over 40, you're high risk by default. And if you're over 40, the risk of things like preterm labor and diabetes and preeclampsia and chromosomal problems like Down syndrome go way up. So if you're over 40, you're going to want to work with a maternal and fetal specialist to have really great screening, really great ultrasounds, and maybe villus sampling and amniocentesis and things as directed by a doctor to make sure that the baby's healthy and it's a successful pregnancy. But it's absolutely happening. Things are changing.
Right.
People are waiting longer because of careers and other things to have that family. And due to technology and changing trends, those kind of things are possible. It takes a lot more caffeine in your 40s than it would in your 20s, but those things are possible.
So ideally, Doc, when is the best time really to have a baby? What are sort of we built for?
Yeah, I mean, we're built for that range somewhere between, you know, late teens and early 40s, late 40s. Somewhere in that mean is where it's the safest, of course. But, you know, due to technology, we can have babies later, which is great. One of the things I think that's really interesting, if you look at the macro picture, that the global birth rates are plummeting.
Right.
You know, we're doing okay here in the United States, but if you look at a place like South Korea, to me is so interesting. In order to maintain a population, you need about 2.1 babies per woman to keep populations the same. Places like South Asia, they're like 0.7. They're like 3 times less than what they need to maintain their current populations. And we don't know why that's happening. But when that does happen, you've got this inversion. You've got all these elderly people on Social Security and Medicare. And you don't have young people entering the workplace and paying taxes and all that kind of stuff. And so these are really interesting, and we don't know why this is happening. Why are women having a harder time getting pregnant across the world in industrialized nations? Why are global sperm counts decreasing like they are? Is it due to environmental toxins? Is it due to microplastics? Is it due to things we're eating, we're exposed to? We don't know, but I think that deserves a lot more study. It's very interesting to me.
Yeah, absolutely. It reminds me a little bit of the research that's going into autism and what is causing autism, right? We maybe need the same research about why it's becoming more challenging to have babies in the first place.
For sure. I mean, there's social stuff. I mean, millennials are not having babies the way older generations did, that's for sure. But there are other biologic pressures at play here too, from a global standpoint. But the one thing we do know is that women over the age of 40 here in the United States are absolutely having babies more frequently. They're able to do that successfully due to great perinatal care, and I think it's an awesome thing.
All right. Well, we love having you. Dr. Knight, thank you so much.
Thanks so much.
Who has 3 babies of his own.
I sure do.
Dr. Matthew Knight, president of Dermatology. They're all super cute, too. They look just like him and his wife. 8:51.